Wonderful. We're going to get started with the last two sessions of the day. I hear there's a sheet being passed around if you want to celebrate your birthday at the Caregiver Nation Summit. You can sign up because it's a sponsorable opportunity. That was an amazing session. Just so heartening to be part of a conversation focused on both opportunity and vigilance, which is going to be the name of the game in everything that we do over the next 4 years and beyond. As we continue to shine a light on care and the far-reaching impacts of caregiving on families, I want to turn your attention to the screens for a message from Ann White, Executive Vice President of Eli Lilly and Company and President of Lilly Neuroscience. Ann is no stranger to care and how it impacts families and careers without access to the right interventions and policies, many of the interventions and policies that were just talked about on the last panel.
My name is Ann White, President of Lilly Neuroscience. We are proud to support this year's Caregiver Nation Summit in Washington, D.C. I've had the pleasure of working alongside many of you in our nation's capital over the years to advocate for caregiver visibility and support. Like many of you, my caregiving journey began unexpectedly. It was almost 2 decades ago, and I was rising in my career and building a family of my own. My husband and I had just welcomed new twins, and my mom moved in to help care for them. We welcomed her support, and she deeply enjoyed her role as a grandmother. But soon she began to experience symptoms of Alzheimer's disease. And as the disease set in, our care roles reversed. My dad, sisters, and I shared duties, and we watched her with vigilance while also balancing our new dynamic. At that time, there was little hope her doctor could offer. And for both those with the disease and their caregivers, there was a lot of stigma. So our world became small as we focused on keeping her safe. Within a few years, Alzheimer's disease had unfortunately taken her joy of cooking, love of music, and her ability to recognize her grandchildren. While this was many years ago, this caregiving experience stays with me. Fortunately, for those with Alzheimer's disease today, the science has advanced significantly. There are new options for care with those with early symptomatic Alzheimer's disease. And we're continuing to break down the walls of stigma by sharing our stories and encouraging conversations about memory and thinking issues. Still, 7 million Americans face Alzheimer's disease today alongside their care partners and support networks. It's my hope that with new scientific advances, the outlook for a new generation of caregivers evolves. Better detection awareness, new diagnostic tools, and treatment options offer us this hope. For those caring with people with Alzheimer's disease today, please know that you are seen and supported. And for anyone caring for a loved one with a disease that has few options, let the story of Alzheimer's disease science offer hope. With perseverance and advocacy, caregivers can ignite change that better supports care partners and the people that they care for. Thank you for your unwavering dedication to care, and enjoy the summit.
We're grateful to our friends at Eli Lilly for their Care Champion support. Next year, we'll celebrate another birthday. We'll celebrate the 60th anniversary of the Older Americans Act. Love it. We should be clapping for as much as we can clap for. The Older Americans Act is a bedrock program that serves older Americans and their family caregivers. From respite care to home-delivered meals, the program is essential to helping people age with dignity in their communities and in their homes. With the program up for reauthorization, this is a critical time to reflect on the program's impact on family caregivers and its alignment with the national strategy to support family caregivers. I know many of us will be taking this message to Capitol Hill tomorrow as we educate members of Congress about the vital importance of the Older Americans Act for supporting our nation's family caregivers. And to guide this discussion, I'm excited to welcome Sandy Markwood, President and CEO of U.S. Aging and also a cherished NAC board member. Welcome, Sandy.
Jason, I love the music. We need uplifting music, and that'll get us going this afternoon. Thank you so much for having me here. I am so honored to be at this summit. It's so critically important. Caregiving is an issue that has always been important, but it is growing in importance. And I want to really recognize the National Alliance for Caregiving and Jason for all of the hard work, energy, and effort they've put not only behind this summit, but in raising up the whole issue of caregiving, not only in this city, but in this nation. So Jason, congratulations to you and your team. So the Older Americans Act, I was really thrilled to hear you all clapping for it, and I'm going to be thrilled to hear you advocating tomorrow. You know, as Jason said, the Older Americans Act will turn 60 next summer. You know, 2025 is a big year of anniversaries. The Older Americans Act turns 60. The Older Americans Act was passed the same year as Medicare and Medicaid. It was passed first, but it was passed on the discretionary side of the budget instead of the mandatory side of the budget. And so funding has always been an issue for the Older Americans Act. But the Older Americans Act is really the national commitment to ensure that older adults can age well where they want to age, which is at home and in the community. And to do that with supports and to be valued as they're aging there. And it is so critical that since that act was passed in 1965 and signed into law, that since then, on every reauthorization, the act has advanced and it has grown to include more services and supports that older adults need to age well at home and in the community. And it's always been passed on a bipartisan basis, which is key and critical as we move forward. In each of the reauthorizations, as I said, things have been added to the act that really enrich it. And hopefully also because of the service delivery through the National Aging Network has enriched the lives of millions of older adults. But in 2000, in that reauthorization, something very important and quite honestly magical happened, because that's when the National Family Caregiver Support Program was added to the Older Americans Act and has really become a major pillar of that act moving forward. So when we're looking at today at the Older Americans Act, it is supporting 12 million older adults and caregivers every year. And in doing that, it's delivering critical services to older adults. Critical services like nutrition, meal programs, looking at medically based transportation, a range of in-home supportive services, home modification, but also because of the National Family Caregiver Support Program, it is delivering those critical services that Jason mentioned, whether that is support programs for older adults, looking at information and education, recognizing that people become caregivers, they weren't trained to be caregivers, and important respite programs. But in looking at the Older Americans Act, because it's on the discretionary side of the budget, not only do we have to advocate every 5 years for its reauthorization, we have to advocate every year for appropriations to ensure that that program gets funding to be able to deliver those critical services at the local level. Funding in the Older Americans Act, as Jason mentioned, also enabled the U.S. Department of Health and Human Services to develop, to update, and to improve the national strategy to support family caregivers, which has become a bedrock and a North Star for where caregiving needs to be in this country. As we look towards the future, and we look towards the future of reauthorization of this very critically important act, I'm here to tell you that it needs to be reauthorized. I'm also here to tell you that technically it expired at the end of September. Now the act is still in place because it's still funded, and it will hopefully continue to be funded. At what level is a big question mark. But every piece of legislation that isn't reauthorized, I believe, is at risk. And I believe now is the time, and I'm so thrilled to have you here going to the Hill tomorrow to talk about the importance of reauthorizing the Older Americans Act. Where does reauthorization stand? Very, very quickly. NAC, all of the folks that are up here on the panel, you all have been advocating now for well over a year for reauthorization. And because of that advocacy, last July, you know, time is kind of flying differently now, isn't it? At the very last day of July, the Senate passed their reauthorization bill for the Older Americans Act. And it was a bill that had some increases in it, asking for increases in authorization levels, and some sections of the bill that really looked at modernizing the act for the future, whether that was looking at contracting, enabling the aging network to contract with healthcare, not only for aging services, but also for caregiver services. Looking at how we deliver evidence-based programs and also expanding that to evidence-informed programs. It made changes in the act that will really help support older adults and caregivers moving forward. That was the Senate bill. And since that bill was passed, and even before that, you know, all of us as advocates have been up on the Hill talking to the House offices about the importance of reauthorization. And I have one of my policy team, Seth, is in the room and has been up there talking on both sides of the aisle on the importance of getting this act over the finish line. And we're here to say that there are a lot of Republicans that are interested in the reauthorization of the Older Americans Act as Democrats up in the House side. When you go to the Hill, you need to tell them how important it is to get this act passed in the lame duck session. There is still hope that that can happen. But they need to hear from you as advocates, and they need to hear from you loudly that this act is important. It's important to submit the national commitment that was signed into law in 1965 to ensure that older adults in this country can age well in their homes, in their communities, with independence and dignity and purpose. In saying that, if we don't get it passed in the lame duck session, as advocates, we'll be coming back to you with the new Congress, and we will have to be even louder to get this act passed and over the finish line. And I say this because with the Older Americans Act, the nation's older Americans and their caregivers are counting on us, and they're counting on the services and supports that are in this act to help them live well at home, to help caregivers in their heroic acts of helping people live well at home. This is not just something that's nice to be done, this is necessary, but it will take advocacy of all of us in this room and your colleagues across the country, again, to get across the finish line. I am so proud and I am so thrilled to be on a panel with such great advocates. And I'm going to turn to them now and have them introduce themselves, tell you about the organizations they're from, and why caregiving and the Older Americans Act is so important to the work they do, but also to their personal passion and mission for serving older adults and caregivers in this country. And I first have the privilege of turning to Dr. Cruz.
Thank you, Sandy. And congratulations to NAC for this amazing event. And Jason, thank you for bringing us together. Sandy, thank you for your very thorough summary of what's a very complex policy and a very important one. So thank you for that. So I am Yanira Cruz. I am the president and CEO for the National Hispanic Council on Aging. Our organization's mission is to improve the lives of Hispanic older adults, their families, and their caregivers. So we have specific areas of work. Health is one of our key priorities. Housing, we provide direct housing to older adults who are able to live independently. As a matter of fact, we do have own and operate a housing facility here in DC on 12th and W, for those of you who are locally based. Our office is actually headquartered there in the first level. So, and then we also have a second building in Garden City, Kansas. So housing is another important priority for us. Economic security, leadership development, and caregiving. So those are the areas that the National Hispanic Council on Aging is focusing on, has been working on for a little over 50 years. And with that, I wanted to also just briefly share with you that, first of all, I was a caregiver for my mother about nine years ago. And I had the great privilege of, being with her when she needed her daughter the most. And it was the least I could do. I feel great pleasure that she stayed with me during the last weeks of her life. I think it was both important for her, but also for me and the rest of the family. So I take this work with that experience in mind. And, after that experience with my mom, I thought, we really need to understand some of the challenges that Latino caregivers are going through, and what are the barriers, and how can we best help them in this journey as caregivers. So we took on the role of developing a survey, and surveyed a little over 400 individuals across the country, including Puerto Rico. And it was an important project because it gave us a glimpse into some things that are important to keep in mind. First of all, many Latinos don't self-identify as caregivers. And this was very clear in the survey. Why is that? Well, because culturally, we grow up thinking that, our parents, our grandparents, our aunts, the extended family is an important circle that we need to help in time of need. This is part of our familismo. Some of you may have already heard this term, familismo, which has to do with the importance of family for many communities, including the Latino community and others. The fact that many Latinos don't self-identify as caregivers can be a problem, specifically because they don't look for help, they don't self-identify as such, and therefore, whatever services might be are available, they're not tapping, even though they need them. So respite care, for example, they may not even think of that because they might feel that they're not good daughters or sons. So that finding is important because that gave us the opportunity to speak about the issue and to help Latinos understand that it's okay to ask for help. It's okay to take time off from taking care of mom, and there's no need to feel any type of guilt about it. So that was an important finding. The other thing is that folks told us in the survey that they wanted more training on how to be good caregivers, how to take good care of themselves, self-care. And we know that if they take care of themselves, they will be good caregivers, and therefore the person that they're caring for will be better off. So those are some of the findings that I wanted to share with you briefly. The survey, like I said, is we have a report. If anyone is interested, I am happy to share it with you through Jason, but it is available for further information. So I will stop there and turn it over to my next.
Susan, okay. Can you hear me? Okay, wonderful. Susan Reel, the CEO of East Central Illinois Area Agency on Aging. If you know Illinois, we're south of Chicago, we're the Bloomington Normal area, Champaign-Urbana, the home of the University of Illinois, Charleston, Mattoon, Decatur, and Danville. So I've actually celebrated my 39th year as an area agency employee, now the CEO. But I have to say, as a storytelling moment, my connection with the Older Americans Act, of course, is 39 years. I'm very honored to be a part of that. But when that amendment went through, the 2000 amendments that Sandy described, the actual kickoff was in September of 2001, several days before the 9/11 attacks. I was here in Washington, D.C. at Administration for Community Living Summit to kick off for the first time how we as area agencies on aging are going to implement this joyous, wonderful caregiver support program, commonly referred to as the Title III-E program, because we had the opportunity to be creative, to be able to respond to family, non-paid, informal caregivers. And the reason why there was so much energy and optimism in the room is because members of Congress, those individuals that actually pulled the trigger and said yes to an amendment to the Older Americans Act, was truly an act of Congress, right? You've heard that term and how hard that can be. But it was because those members of Congress are actually experiencing caregiving, family caregiving issues themselves. So that, again, is the storytelling we learned yesterday from our wonderful speaker, and that is a story that we'll continue to convey. So I just wanted to share that with you as my introduction. There's a lot more that we do that I'll share in terms of our Illinois Family Caregiver Coalition and the work of the area agencies, but I want to give all of my colleagues an opportunity to introduce themselves. So thank you.
Thank you. Good afternoon. Valerie Tsosie, last chance to Tanessa ni Bashichin. To the genie that she do Kabandashanale. Ahead the Koya Nakashin Laiki. I am Valerie Tsosie, and I'm the founder and CEO of the Tsosie Foundation, and founded out of the Navajo tribe. However, I service and help all across the nation as I've gone through to notice that we all need help. I honestly, it was such a naive thing with me. I was just telling my story earlier to somebody and saying that my background is not in social work, it's actually in business. And social work had just come on when I moved back home to the Navajo Nation. And we cover 4 states. So everybody keeps asking me what state. It's Arizona, Colorado, Utah, and New Mexico. So I'm so thankful for you guys all to see my governor. I claim her. So I'm so excited that you guys have her. She's amazing. And that's the work that we do with the Older American Act. I believe there's 6 or 7 titles. We are number 6, which is actually Native communities. So that funding actually works with a lot of, not just the Navajo tribe, but all across the nation. And that's what brings in a lot of the services that were brought up. And it's important because as Navajo Nation is one of the biggest tribes in the nation, we're about the size of Illinois. However, we only have 13 grocery stores, like actual grocery stores. The rest would be like like a gas station. You know how they have a little section like that? A lot of those are actually WIC stores, if you're familiar with WIC. I used to work with WIC. And those actually become WIC stores because we don't have those grocery stores. So the food insecurity is a real thing. There's services, and with the Older American Act, that helps us provide a lot more of that, but definitely we need more money for sure. And advocating tomorrow and having people be aware of this is so, so important, not just for, again, the Native community, but for everybody here. I'm just finding it more aware that just nobody really knows what services that they have, and this is going to be a rude awakening when they start taking it away. And you're going to say, oh, I thought that was covered. Nope, it wasn't. So again, this Older American Act, we definitely need that funding for sure for us to go forward and keep providing some of these services, and for not just Navajo Nation, but for a lot of our indigenous communities, we have lack of infrastructure. So when we do talk about going out of out of bounds. I really like that. You have to be innovative. But then we have a lot of this telehealth that's going on with broadband. Well, if we don't have broadband in the areas that we are, how are they going to get services? This includes telecommunication. There's, we have flip phones that work better than the new, the new iPhone stuff. So we have to be thinking about that as well as language barriers in figuring this out. I was really interested in that Medicare. I still don't get it. I've been working with these guys for 10 years. I'm like, I don't know, DCAE program, and I'm like, what in the world? Can we please streamline this and how we can make it a lot more, I guess just a bit easier for everybody because it's so confusing. So thank you so much.
Wonderful, wonderful. What a great panel. Well, I've got some hard questions for you. Well, first off, this is a question for everybody on the panel. The Older Americans Act, as we talked about, has been really instrumental in being able to support older adults and caregivers for decades now. So from your perspective, what are some of the most significant successes of the Older Americans Act in building caregiver-friendly communities? And what are the key ingredients that have made these work? Yanira?
I can get started. So I think the Older Americans Act is the crown jewel in our space. I think it's the best kept secret. So many people don't know about it and the services that are connected to it. And like you said, until they go away, then we'll realize how important it is. And that's what we have to ensure that we protect it and we reauthorize it and it stays strong. So I think training is definitely one of the important elements that I like to highlight. Training on things like chronic diseases, specialized care, how to navigate the healthcare system. All those are important issues to be trained on when a person is a caregiver, for example. And just empowering and educating people so that they feel comfortable and confident helping and navigating the process of being a caregiver. I think the other important thing is the expansion of supportive services for diverse communities, and the importance of the law to have specific language that helps us serve the diverse population that we have in our country. And this diversity, as we know, continues to grow. And so with that growth, we need to be able to have the necessary support and services so that we are providing services in a way that is culturally competent, that is linguistically competent, and that it's appropriate for the care that our communities need. So I think those are important pieces that the Act is sort of, I like to highlight. Yeah, I'll stop there.
So I'd like to add to that, we'll just do connecting the dots here. The Older Americans Act also designate area agencies on aging to be grassroots, to represent the community, to be in your communities. And so the way we have been able to implement Title III, the caregiver program, is through the development of a series of caregiver resource centers, to be that local entity that can be the expert in all things caregiver. So by virtue of, and the beauty of the Older Americans Act and the designation of the area agencies on aging, it was an honor for us to start that step in establishing those caregiver resource centers. So for example, we've been able to implement not only the respite programs that everybody identifies with as a needed caregiver services, but as the doctor said, we also have the opportunity to help a caregiver navigate the myriad of different benefits that would benefit their loved one as well as themselves. We heard earlier that many of the caregivers are on Medicare themselves. So that also is a cornerstone of how we designed our caregiver support services. And then training and education and support groups. Again, managed by local grassroots entities in collaboration with AARP or Alzheimer's or other entities. There's always, again, a huge level of collaborating with community partners and getting these services going. And then making sure that there is a way for us to make sure that they have a connection with medical support, understanding the long-term care systems, meaning how nursing homes and supportive living. So it is a comprehensive view of being able to provide that support services. And the Older Americans Act Caregiver Program allows us to do just that. And we were able to serve 20,000 older caregivers serving older adults in Illinois. We have 1.3 million in Illinois. We're woefully underserving. So again, the importance and the value and the cost savings by that family caregiver being able to keep that person at home, those many areas are coming into play to continue to monetize that, to ensure there's a return on investment. We've grown into just not an information and assistance program into actually doing formal assessments, and formal assessments through very comprehensive systems like T-Care, where you actually identify the pressure and the stress a caregiver is experiencing and connect them with the right community services, not just services that are grown through the Older Americans Act, but all the many other community benefits. So it is comprehensive in nature, very targeted to supporting that caregiver in many different ways so they can continue that support. And that's the way it was designed from the very beginning. So that's another key ingredient of the Older Americans Act.
Okay, Valerie?
I love that. I feel like the main point in that is having the diversity for sure, because I said Title VI in the Older American Act is for Native communities, and grassroots is so huge. Because, I mean, there's one thing I do love about it. There's so much flexibility in the Older American Act that every community is not the same, right? The city functions different, the urban community, it's the rural community, and the tribal system it's actually the same. I'm considered from the city, which is not really the city. We have the border towns, and then we have, like, again, a real city that you have all these different functions. So in that, we're able to have our native foods that we're able to have in there for our elders. So you can have that at congregates where they can come together. So like for my area, we have blue corn mush, and we also have like mutton at times. Tortillas, not Hispanic tortillas. We have our own type of tortillas, but there's all those different things that we can incorporate, which is awesome. And that's where the grassroots part of it comes in. It helps us keep in our communities. And then what I finally recently found out again too is that we could even butcher, because our main dish, I guess you could say, our main meat is sheep. So we could actually get a sheep come in and butcher that sheep and use that meat for the senior center, which would be great, because that's how we function in our community. And that's the diversity, again, that she was talking about, the grassroots part of it, that it gives us that autonomy in our areas for have our community claim, the Older American Act, and that's how they help us. That's why it's so important for all of us to have that, because a lot of programs, especially federal programs, right, they want to have all these restrictions. You can't do this, you can't do that, USDA, whatever else. But we need to have those, especially like having your garden, garden to table programs as well, incorporating those things where we bring in, again, food scarcity is huge. So when we have those where we can be connected back into our own grassroots in our community, we have that to come into the senior centers, and they can use that food. So that's just one of the additional grassroots programs I wanted to highlight.
Well, that's great. So when we're talking about the Older Americans Act, the themes that I'm hearing are person-centered, being able to be culturally competent, comprehensive in meeting the whole needs of the person and the caregiver, and the flexibility, Valerie, that you pointed out that allows that to happen in the Older Americans Act. Well, Susan, I'm going to turn to you now. As the CEO of the Area Agency on Aging, you work on the front lines, and you have for 39 years implementing Older Americans Act programs. What are some of the biggest challenges you face in delivering caregiver support services? And what kind of policy changes or additional resources would make the biggest difference in your ability to meet the needs of caregivers in your community?
Thank you, Sandy, for that question. It is something that we as an area agency network, especially in Illinois, have been concerned about for many years. And so the issue of funding has always been a challenge. With those 1.3 million estimated caregivers in Illinois, there's $6 million federally that's been allocated through the Older Americans Act. We've operated for 21 years with approximately that amount of funding. But we know the demand is there. The demand's going to continue to grow. We've had to be able to respond to increased funding. So instead of a future current concern, we did address it in terms of our advocacy as an area agency network to bring more state funding to support our Illinois Family Caregiver Support Program and to support this infrastructure under Title III-E that was already in existence. And that funding was successful in our advocacy, and I want to recognize Diane Slezak in the room, as well as Amy Brennan. So we have that strong advocacy, and that's also built in an area agency mission. We're mandated to advocate, so with that we were successful. But now our challenge is preserving that funding and preserving it at the federal side, and we received $5 million. We were advocating for $6 million, meaning a match dollar for dollar. So preserving that funding, as well as preserving our Older Americans Act funding. And all of that comes to making sure we have that messaging to show what a difference the caregiver program has made. And then the other policy is we can't do it alone. The other policy challenge is we need to collaborate, and with the support of the Retirement Research Foundation, we were able to create the Illinois Family Caregiver Coalition that brought non-traditional partners to caregiving in Illinois together, as well as our traditional partners like Alzheimer's, like AARP, like higher education. But we have over 400 members now that are bringing awareness, carrying out all the requirements of the RAISE Act, awareness, making sure we bring attention to services, as well as following public policy and impacting public policy. But our Illinois Family Caregiver Coalition has really brought one voice to the issue, one voice that we've been able to clearly communicate to lawmakers, to the community, to local units of government, to obviously the state units of government. That has also been a very successful endeavor. We're going into our third year now, and so there's a success with legislation based on our Illinois Family Caregiver Coalition, but also there is continued momentum to support the services that we provide, and to really bring a whole set of new partners to get behind us as we serve. And really the crowning glory to that is a multi-sector plan on aging that our Illinois Family Caregiver Coalition Director and Area Agency Director now will be able to, the Illinois Sector Plan on Aging, state directed, will now include other state agencies in that coalition building and planning. So that, I wanted to be able to answer it from that perspective.
That's great. That's great. Dr. Cruz, the National Hispanic Council on Aging advocates, as you said, for Latino older adults. But how can the Older Americans Act be strengthened to address the specific cultural and linguistic needs of Latino caregivers and ensure equitable access across all of those services?
Thank you, Sandy, for that question. So I think we are expecting a significant growth of older adults in the Latino population over the next 20 years. With that, we require additional services, additional support. So clearly, keeping that growth in our diversity as we look at the demographical changes will be important. And making sure that we maintain in the law the importance of providing services that are culturally competent, that are linguistically competent, so that folks can use the services effectively. The other important thing is preserving the resource centers that are included in the Older Americans Act. These centers are important because each of the populations, the major populations in our country, African Americans, American Indians, Asian and Pacific Islanders, Latinos, Hispanics, have a resource center tailored to their needs. And it's important that we continue to strengthen those centers, that we continue to learn from them and preserve them. So I think that will be an important piece, as well as preserving the CSAP program to ensure that our communities, our low-income communities, all of us have access to necessary employment opportunities at that point in our lives.
That's great. Well, Valerie, the Tsosie Foundation focuses on serving Native American communities. And can you speak to the unique needs and challenges of Native American caregivers and how the Older Americans Act has been leveraged to better support them? But also, too, in my question is, what culturally specific approaches have proven most effective in Native American communities in serving caregivers?
Somebody take notes for me on that? That was a lot.
There's a lot in
Yeah.
there. I'll take it apart for you if you need to. But I really, you eloquently, talked about all of the different services that are being provided. And I just wanted you to dig a little deeper there.
Okay, sure. So the barriers for sure is, again, infrastructure. So a lot of the areas don't even have paved roads. And even if they have dirt roads, if you guys know dirt roads, you need to get them graded, because if not, you're going to be mud bogging through the whole area. And then that includes what? A 4x4 type of ride. How much does that cost? Cost of living at a lot of Native communities, we are like in third world conditions. As I said, we're one of the largest nations, but we only have the 13 grocery stores. That covers a vast area. So food insecurity is another big issue. The broadband is another issue. Fourth is we have a lot of barriers in the language and cultural concepts. So some of these, that's part of my job, is where I will go in and have a program. So I've talked about working with Duet. They're a nonprofit out of Arizona, and they have a dementia program called Finding Meaning and Hope. It's a 10-week series, and as I was in the community grassroots, what I noticed in my caregivers is that they needed more support in this. So that 10-week session was very in-depth. A lot of our cultures do have like, I don't want to say taboo, but it's you have to be culturally sensitive, especially about death and end of care. However, these are realities. So in a way, you can't just throw it in Native communities' faces in that way. There's a type of approach. There's a way that you talk about it. And I had to be very, very conscious of that, and as well as having it translated. So in the 10-week series, they also have 10 videos. So I was able, when they approached me, I had already said, okay, we'll go ahead and take this for training for our caregivers. And I translated all of the content into Navajo. And then the videos, though, were still in English. So I was able to get some of those videos, or actually all the videos, some counterparts with me, and we translated them into Navajo. So in that is how we address some of the end-of-life issues that we need to address, because even in those cultural, again, competencies, it's hard and it's different as well. So caregivers, it's not the same as it was back then for everybody, right? Like I know somebody earlier was talking about how I used to see my mom do things for my grandparents. Now what do? How do I go about it? Especially advancing in technology, which I just said we can't even use. So it's like, how do we go about some of those type of things? But in some areas, we do have cities or agencies is what we call them on Navajo, where there is some technology issues where we can bring those in. for certain folks, but it just depends. And those are the things you have to be cognizant about of how to go about it, especially again with the training, I think is a huge piece too, of translating it, making sure it's relevant, because some of those issues that they bring up, it is important, but you have to adjust it to what's the reality of what's going on. So one biggest one is respite. We actually have a hard problem with respite because we as a community don't have strangers coming in taking care of our own. And that's hard. And that's where with having so many regulations on it and saying that we need this, but if the community doesn't, they're not gonna respond to it. So we have a hard time figuring out how we can do that. And, but the flexibility, you just have to be really creative in how you're gonna go about it and seeing what you can do. But what I love about the Older American Act is that we can have discussions like this together and troubleshoot some of those things, what's worked, what hasn't worked, and we can try to build on those and how we can have the more services actually for our area. Honestly though, I know she said 6 million, and we both said that's not enough. That is not enough at all. You think that's a lot of money, and it's not. We really need to have some of that funding to be for somebody doing the work. And if I don't know if any other areas have that same thing, like you have that one person doing 30 jobs, and you want to add something great in there, but if you have only that one person to add that one more thing that takes so much time, now you have to start vetoing all of these things and figuring out what's going on. So that's, I think, one piece that I just definitely want to advocate on is we need to have that part of it. And as well as for tribal communities, yes, we are sovereign. We have our own governments and our own way of doing things. The federal government always wants us to go so fast. Like, we gave you the money in January. You should got it processed in February. For the Navajo tribal system, it takes us around 6 months to even set all of that stuff for us to use the funding. So we lose half a year. And then they want us to use it so fast, and then they say, okay, now we're gonna renew it again.
Yeah. Well, you've hit on an important point that I'm going to ask everybody as we wrap up, because all of these people are going to be going to Capitol Hill tomorrow. And I am hoping that the Older Americans Act is a major discussion point for all of you. So, as they go to the Hill tomorrow, what is the one message, the most urgent message that you want this room full of advocates to convey on Capitol Hill tomorrow? Who wants to go first?
I'll go first.
All right, Susan, you go first.
Okay, back to storytelling and how powerful that is. And we survey all of our 20% of our caregivers, and to be able to hear over and over again the caregivers telling us, if I didn't have you helping me deal with all these benefit applications, if I didn't have you to help me with support groups and training, if I didn't have you to help me in getting connected with mental health services or counseling services, or getting me connected just with someone who can listen to me and help me through this process, I would not have been able to do what I do. I would have ended up putting my loved one into long-term care facility, giving up my ability to provide that caregiving. So that is so powerful when you hear that over and over again from the caregivers, that we're just asking, what did our program, our caregiver resource centers, what were we able to do for you? And to hear, if you weren't there, we would not have been able to do what we were able to do in terms of helping that continue providing caregiving to our loved one. And I think that's the message that we just need to boil it down to that. If the Older Americans Act Caregiver Program wasn't in existence, more than the caregivers that are receiving services would basically have to give up.
And I would just add to ask for the Older Americans Act to be reauthorized and appropriated, and to also ensure that we continue to fund the resource center, because there is word in town that they're being targeted, and those resource centers are important to preserve. Also, I want to acknowledge the Diverse Elders Coalition. We are a member of that coalition, and I believe Didier is here somewhere. He's the director of the Diverse Elders Coalition, and we have been very concerned about this process, this reauthorization, and making sure that our communities have a voice at the table. So I want to acknowledge that work that is going on, and I know the Diverse Elders Coalition will also join you tomorrow. Pedro Lima from the National Hispanic Council on Aging is here. So we'll be making sure that the diversity of our voices is also represented tomorrow during your important day of educating legislators and letting them know how incredibly important this program is to ensure that older adults live in dignity in their old age.
Thank you. Valerie?
I guess I'll add is, don't we have a tsunami of boomers coming in? Well, how are they denying that? Who's gonna take care of them? I mean, what are we gonna do? They're gonna shut their program down and then try to take forever to bring it back? You know, I think you're reminding them that who is gonna take care of these people, if it be their own family members, their community members. It's so important, everything else that you said. And it's, if we don't have those programs, I mean, some people, they come to, just like in school, again, food insecurity, they come for community. So breakfast, lunch, and dinner. If that elder's not getting that, and then we also have where they get home-based food. So somebody will go from the senior center, will go to their home, to the elder's home, and deliver food. And they actually do like small housework there. And for us, the uniqueness is like cutting wood, because right now it's getting cold. Taking those in, maybe getting some water. We still have about, I believe that what did they say, like 65% of Navajo tribes still doesn't have running water in 2024. So we would have to go out, take your ride, go get the water, haul that back. That takes time, money, and effort, especially for our older community. And who's gonna do that now? Because a lot of them, again, times are changing. People are moving off the reservation because they have school, jobs. We need that, you know, the money there, but they're not getting it. So they live in border towns. And who's going to be there to take care of grandma or mom or whoever the family community member? Some older people actually don't even have any kids. So for us, thankfully, we have, again, community people, like they're saying, oh, that's, you know, so-and-so's cousin or something there, and they know. And we have clanship to say, you need to go watch your, you know, aunt or something, or make sure we tell the senior center so that they can go check on them. And that probably might be the only person that visits out there, because again, that's a rural area. What I've heard from the senior center is that one house was actually an hour away. Yeah. An hour away to deliver food. And they really were stretching it because they're always supposed to go so in a radius, but the grandma was just, she really needed help. She needed that support. So they wanted to give her as much as they could, and if this funding doesn't go through, who's gonna do that? Because that's gonna cut that person from going out there.
You know, I would be remiss if I didn't also focus on grandparents raising grandchildren. The Older Americans Act provides, yes. You know, basically a lot of today's been focused on, you know, the informal caregiver and family caregiver, but we envision that as a caregiver providing care to an older adult. But the grandparent raising grandchildren is the beauty, again, of the Title III program, because that was also a targeted area that was not getting any attention back in 2000. So that was always part of the caregiver program from the get-go. So that too is another resource that grandparents raising grandchildren, there's very little out there. And let me tell you, they have one barrier after another that's been raised against grandparents raising grandchildren in providing care when they receive that grandchild or child, a relative child, in a very difficult situation. So our caregiver resource centers are also equally responsive to their needs and provide that same level of support and care. So I'm sorry to interrupt at that time, but of course, grandparents raising
That
grandchildren.
is not an interruption, Susan. That's a very important part of the National Family Caregiver Support Program. And as we look at this and you all go to the Hill tomorrow, I think what you've heard from the panel is tell the stories. Tell the stories. And also recognize that most of the people up on Capitol Hill are just like you, and they either, what does Rosalind Carter say? They either are a caregiver, they've been a caregiver, they will need a caregiver. When you look at that and you look at the humanity that is sitting up on Capitol Hill, both as staff and as members, caregiving is an issue that hits home to them too. You need to hit home with your stories, with your data. And I think what Valerie said is, if this program doesn't grow to meet those needs, what will happen? What will happen if we can't keep older adults, people with disabilities, people who need caregivers, where they want to age, where they want to live, which is at home and in the community? But we can't do that if we don't support the caregiver. So with that, I want to thank this incredible panel. I'm so honored to be here, and I want to thank you all.